The design of the thoracic spine is meant to protect our hearts, lungs, and other vital organs, as it is very stable and not meant to move much. The discs in the area are smaller and better protected than in the low back and neck. Danease Evans from Saraland, Alabama tells us about a random accident that affected a large portion of this area of her back.
On November 30th, 2015, I was getting on an airplane and there was ice blowing into the jetway, and I hit the ice and flew into the air. I looked like a cartoon character, went up and landed on the top of my spine and fractured, I think it was T7 to T9 on my spine, and broke 4 ribs. The day that I fell, like instantly, it knocked me out. I was out for a good 2 minutes. And when I came to, I guess the airport ambulance is what they would call it, they were trying to get me up off the floor, as well as a doctor that was there. And in the days following, I couldn't hardly get a breath. Between the ribs being broken and the fracture in the spine, I couldn't hardly get a breath. I couldn't stand up and walk. It was hard to move, trying to fix my hair, moving my arms, anything, because it was in the very center of my back. I could barely do anything. The pain was literally debilitating.
As time progressed after her slip and fall, Danease tried chiropractic care, massage therapy, and pain management to alleviate her pain. She visited a doctor who wanted to try an experimental surgery with hardware. Finally, Danease's longtime friend Deborah, also a Bonati patient, convinced her to submit her MRIs to the Institute for a review.
During the 1.5 years before I came to Bonati, it was constant doctor visits. It was constant epidurals, pain medication. There's nothing we can do. We can try exploratory surgery. We can put a cage in to stabilize, which I've never heard because I was not unstable as far as I knew. And the doctors were saying it wasn't unstable. It was just one of those things that they didn't want it to destabilize. So I had the options of a rod or a cage, which if it shifts, then it's going to compress even more, is what I was told by the doctors. And so it was constant pain, constant back and forth with the doctors. And it just, nothing relieved the pain. And then Deb Sessions convinced me, hey, you need to just send him your MRIs. It's not going to hurt anything. Just try it. Just send them in. So I sent my MRI in, spoke with Jenna, and within 2 or 3 days, Dr. Bonati called me. He said, hey, Danease, how are you doing? I said, I'm great. And he said, let's fix you. That was the first things he said to me was, let's fix you. And I said, okay, what do I need to do? And he went through the process on the phone of what would go on, how he would take care of things. And he said, how fast can you be here? He said, can you be here the first of the week? He walked in and got his little red pencil out and walked over and started marking my MRI up. And he said, lay down. And he started touching my back. This was how he was explaining to me what was going on. Other than that, he didn't, other than saying hello, he didn't really talk to me a whole lot. To begin with, he said, lay down. And I said, okay. And so he started going through my back and he said, you hurt here? I said, yes, sir. He said, you hurt here? I said, yes, sir. And he hit the top spot. He said, but you hurt here the most. And I was like, okay, I didn't even tell you anything. I never said a word to you. You walked in and told me the problem. As a patient, you don't want to hear, let's see if we can figure it out. You want to hear before a doctor walks in, they know what's going on. And he walked in with the room with me. He knew what was going on immediately. I didn't have to question. I didn't have to wonder. He just knew.
Because the Bonati spine procedures are performed using local anesthesia and conscious IV sedation, the patient is comfortable, responsive, and able to provide feedback to the doctors throughout their procedure.
That's the nerve.
I can already feel a difference if I can breathe.
You can breathe, huh?
I can get deep breath. Yeah.
Move the other.
God.
Now it's gone?
Yep, that's gone.
Gone, all right?
Yep.
How's
Can I
it
move
go?
the left one a little bit? Because it's, yep, that's it.
This patient involvement in surgery is the key to targeting the pain with pinpoint accuracy and provides the patient with peace of mind that their pain is gone for good.
The morning that I had surgery, I was anxious and nervous just like anybody is, because my first surgery was just an ablation. So all I'd heard about was the laser and how they were gonna burn the nerve. And so I was super, super nervous, thinking that I was going to feel it because I was gonna be awake. I was awake through the entire surgery. I talked to Dr. Bonati. He asked a lot of times, where does it hurt? Where do you feel this? Is this uncomfortable? What other doctor is gonna ask you, are you okay, while you're on an operating table? Number one, you're not gonna know because you're asleep. Number two, his bedside manner is just amazing. He wants to know where you're hurting. He wants to know when he touches something, where you feel it. He wants you to interact with him. He wants you to move your arms. He wants you to move your legs. Immediately, I felt a difference right where the fractures were. No pain. It didn't catch. It didn't hurt. It was nothing. No pain at all. I was in the OR on the table, and I knew instantly there was no pain.
When patients like Danease have severe accidents that create multi-level issues within the spine, the Bonati treatment plan is performed incrementally. This approach to care greatly reduces the risk of bleeding, scarring, swelling, and necessary recovery time. It also allows patients to feel noticeably better, faster.
I've had 11 total procedures because I've had everything from T5 to T11 done on both sides except T7, T8, and I have to have that done on the right side. And a question that I keep getting asked is, why do you have to go back? Why do you have to go back? I'm like, it's not something that's a quick fix all the time. Sometimes it takes longer because of my injury. Mine took a little longer. You just have to be patient. Anything worth having is worth fighting for. Your health is worth fighting for. Take the chance and send your MRI in. Don't let a day go by where you have to hurt longer. Send your MRI in, let him look at it, and he'll tell you if it doesn't work. He'll tell you if he can't help you. He's real quick to tell you what he can and cannot do, and he doesn't play around with it. He'll take care of you.